Hi, I'm Tara Schmidlen, one of the CPMC genetic counselors. Before you view your results, I want to share with you some information about what your results can and cannot tell you. When viewing your results for any condition, it is important to remember that testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. If you think you're having symptoms of a medical condition, please contact your healthcare provider.
Diabetes is a group of diseases that occur when the body either does not make enough insulin or is unable to use the insulin it makes properly. Insulin is a hormone that helps your body use glucose or sugar from the foods that you eat to provide energy for all of the cells in your body. There are 3 common types of diabetes. Type 1 diabetes, which used to be called juvenile or early onset diabetes, occurs in people whose bodies do not make enough insulin. Type 2 diabetes, also called adult onset diabetes, occurs in people whose bodies cannot use insulin. Gestational diabetes is a type of diabetes that occurs when a woman's body cannot use insulin during pregnancy. Symptoms of type 2 diabetes include extreme thirst, extreme hunger even after eating, dry mouth, frequent urination, fatigue, blurry vision, nausea, and numbness and tingling in the hands and feet. Please tell your doctor if you're experiencing any of these symptoms. All 3 forms of diabetes have different causes. The results you are about to see pertain only to a genetic variant associated with type 2 diabetes. Diabetes is one of the biggest health problems in the United States, with over 23 million people affected with this condition. Although anyone can develop diabetes, it occurs most commonly among African American and Hispanic people. There are many factors that make up your overall risk for developing type 2 diabetes, some of which you can control and some of which you cannot control. The risk factors you can control include your diet, the amount of exercise you get, smoking, and the amount of alcohol you drink. The risk factors that you cannot control include your family history, your genetic makeup, and your race or ethnicity. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 from our father. This means that for every genetic variant that the CPMC study looks at, you can have either 0, 1, or 2 copies of the genetic risk variant. As you can see, your results will tell you the following: how many copies of the risk variant you have, as well as how your genetic risk compares to someone with 0 copies of the risk variant. The CPMC test looked at your risk for type 2 diabetes. Learning that you have a genetic variant that has been associated with type 2 diabetes does not diagnose you with type 2 diabetes and does not mean that you will develop type 2 diabetes in the future. It means that your genetic risk, due to the specific variant, is higher than for people who do not have the variant. Learning that you do not have a genetic variant associated with type 2 diabetes does not rule out the diagnosis of type 2 diabetes and does not mean that you are protected from or that you will never get type 2 diabetes. It means that your genetic risk due to the specific variant is lower than people who do have the variant. Type 2 diabetes is a complex disease. This means that it is caused by a combination of genetic variants in multiple genes as well as the environment. No single genetic variant causes type 2 diabetes, and no single genetic variant is able to completely predict your risk for type 2 diabetes. Genetic variant information can help estimate your risk of type 2 diabetes when considered along with your other risk factors, like your weight, your family history, and your age. We may learn of other genetic variants that influence your risk of type 2 diabetes in the future. As we learn more, your estimated genetic risk for type 2 diabetes may change. Results of CPMC testing alone do not diagnose type 2 diabetes or rule out this condition. Risk factors such as age, family history, or lifestyle may have a greater impact on your risk than any individual variant.
If you have questions about your results, please consider discussing them with your healthcare provider or contact a CPMC genetic counselor.